we are here for the training workshop on monitoring and evaluation for the Department of Public Health, Non-Communicable Diseases Division.
The M&E division can be in charge of running the system, but your M&E system has to run beyond the M&E division. It has to run across the ministry. It has to be properly integrated into every aspect and department in the ministry.
M&E is always seen as an abstract for programs. You always see your program in the vertical, with the vertical viewpoint. But M&E, I think what we've been able to achieve in these few days, we've been able to demystify M&E and establish the fact that M&E is needed across board. And it's important for you to have the M&E plan from even the conceptualization of the program. So the fact that not just that knowledge, but making it very practical and looking at the different stages of M&E has made the training very worthwhile.
So a lot of interventions in the country and in the development sector require an M&E component to be able to monitor and evaluate, the impact of the programs and these interventions on the continent. And the Federal Ministry of Health in Nigeria, being the custodian and the main implementer of most health programs in the country, is not an exception. By virtue of our work as the TCDI and Development Gateway, we've interacted with the Non-Communicable Disease Department and Division of the Ministry of Health for over 4 years. And it's become apparent over time that this is a training that is necessary so that they understand how to track the impact of the programs that they already work on and they already implement in the country.
My objectives for this training have been met from the basis of the MRE to the lectures on how to go about developing the causal pathway, the logical framework, the theory of change. I would say my capacity have been built and my skills in MRE have really been developed.
When it comes to periodic data collection, for example, in the case of monitoring and evaluation, because it's program-based or project-based, you have what? Your baseline, which some people will call risk assessment. For example, you go to a place, you do the risk assessment, collect data about what they have currently. That will inform what other data collection, maybe they are going to do what intervention or not.
This is giving us an opportunity to learn so much from data management up to project management. Because if you are investing in a project, you need to keep monitoring that project. And then at the end of it all, also you need to evaluate what you have done.
Yes, MIE is very, very important. It's vital for public health officials because it helps us to know what we need to do, how to do it, and when. So the question of what, how, and when is answered. And we'll be able to track the progress, whether we have achieved what we want to achieve or not. If we don't achieve it, then we need to revise and learn and move forward. If we achieve it, fine, we move on to the next stage. And it's always very good when you have policymakers coming around to be able to come and learn and share how we could improve on the skill that we have for monitoring and evaluation of the public health in Nigeria.